Thank you guys for coming tonight. I'm going to talk tonight about concussion management, since there's so much going on in the news lately with concussions and the proper way to be dealing with them these days. And now with all the new regulations that we're dealing with at the high school level from the PIAA, as far as return to play guidelines, this is just an important presentation for you guys to see, just so that you're aware of why we do what we do for concussions when we see them in youth, in the youth athletic population. So, okay. So, coordinated health services that we have here, we have concussion specialists trained in the impact testing and head injury management. I'll get into a little bit about what impact testing is a little bit later. We have one-on-one communication between our physicians, the physical therapists, and the athletic trainers, and team orthopedic specialists for many of the high schools and colleges in the area. We have Care on Demand, which is actually located downstairs in this building. It's walk-in urgent care centers. They're across the Lehigh Valley. They treat most illnesses and non-life-threatening injuries. We have full-service capabilities like X-ray, suture repair, IV fluids, and minor surgical procedures. And our locations, the Care on Demand locations, are located at the Bethlehem campus at Highland Avenue, the Allentown campus here in Wind Gap, East Stroudsburg, and Lehighton campuses. And the hours for that are Monday through Friday, 7 to 11. They're a little different in Lehighton, and Saturday and Sunday, 8 to 8. This Care on Demand is actually really nice because it's cutting down on having to sit in an emergency room for 6 hours just to get, 6 stitches in your chin or something. It's you walk in, you walk out, and you're getting great care from our physicians. So this presentation actually is what we put together for our coaches, parents, and student athletes at the high schools. And it's just a preseason informative session to provide information regarding the new Senate Bill 200. This just was passed, well, it's actually taking effect this July. It establishes standards for managing concussions in student athletes. Senate Bill 200 is called the Safety in Youth Sports Act. As I said, it takes effect on July 1st. And most schools are going to hold informational meetings prior to the start of each athletic season for all ages of competitors regarding concussions and head injuries, including the importance of proper concussion management, how baseline preseason assessments can aid in the evaluation, management, and recovery process. And it's also to provide information regarding coordinated health policy and protocol for concussion management and return to play. So what the Safety in Youth Sports Act, their objectives is to provide standards for managing concussions, removal from, and return to play. In the bill, they define appropriate medical professionals, which is later abbreviated as AMPs, which are licensed physicians, licensed athletic trainers, licensed psychologists, or any licensed and certified healthcare professional, all of whom must have been trained in the evaluation and evaluation management of concussions. And the Act also defines mandatory educational requirements with which coaches, parents, and student athletes must comply. So to start, we want to kind of try and define what exactly is a concussion, but there's no exact description. No two concussions are ever the same, and symptoms manifest in different ways for each individual. Every different time that individual would happen to get a concussion. It's defined in the SCAT-2 The SCAT-2 is a sport concussion assessment tool which was developed at the International Conference on Concussion in Sport in 2008. As a disturbance in brain function caused by a direct or indirect force to the head, it can result in a variety of signs and symptoms and often does not involve loss of consciousness. Most people immediately think like, oh, we're diagnosing him with a concussion. Oh, well, was he knocked out? No, he doesn't have to get knocked out to have a concussion. So concussion should be suspected if just one of these symptoms or more of the following are present. Signs, which are on the left, that means they're observed by others. They appear dazed and disoriented, they forget plays, seem less alert, demonstrate difficulty with short-term memory, exhibit coordination or balance difficulties, slurring words, answering questions slowly or inaccurately, seizures or vomiting, or a change in coherence or level of consciousness. And symptoms, those are what is reported by the student athlete. Headache, nausea, balance problems, impaired brain function like confusion or difficulty concentrating, vision problems, light and noise sensitivity, sluggish, kind of presenting like they say that they feel like they're in a fog, emotional or personality changes, or sleep disturbances. So once the student athlete starts to exhibit these signs and symptoms of head injury, they may be removed from play by an official, a coach, or an appropriate medical professional. The student athlete will be assessed using our evaluative procedures, including the SCAT-2, in our guidelines for concussion management. And then after that, parents will be contacted during or following the evaluation, and follow-up home care instructions will be discussed then. Or if we have to send them right away to, say, an emergency room or to care on demand, we'll do that and talk to the parent then. But in the first bullet point, you can see that an official can remove the athlete from play before we do. So return to play. I'm just going to go over this quickly because Tibor is going to go over this after I do. The student athlete may not return to play until he has been evaluated and cleared in writing by an appropriate medical professional. The student athlete will be instructed to rest. Learning support accommodations may be needed. They'll be determined by the doctor. And they'll rest until they've been asymptomatic for 24 hours. And then after that, they'll begin our return to play protocol in our standard operating procedure manual. But what I will talk about is impact testing. Most of the coordinated health schools are using the impact test, which is the immediate post-concussion assessment and cognitive test. It's a computerized concussion management tool utilized by physicians and ATCs. Baseline tests will be conducted based on the guidelines set by Impact and Coordinated Health. So we usually do these baseline tests in the beginning of the season, depending on what level of high school. Like usually it's, I think, 9th grade, freshmen and juniors kind of get tested, and then they won't get tested their senior year kind of thing. And then that way we have baseline numbers in case they do sustain a concussion in their season. So in the event that does happen, severity and progression can be assessed based on the comparison between these baseline scores and the asymptomatic post-injury scores, which means that they don't take the test until they don't have any symptoms anymore, as well as the SCAT-2, that test that we do, and all of its components, which can help determine return to play. And then prior to return to activity, when the athlete is symptom-free and their SCAT-2 test is normal, the athlete is then impact tested as directed by us, then we compare the numbers and go from there. So as per this new Senate Bill 200, this is what's going to be required by coaches, or for coaches. Once each school year, a coach shall complete the concussion management certification training course offered by the Centers for Disease Control and Prevention, the National Federation of State High School Associations, or another provider approved by the Department of Health. And the coach cannot coach an athletic activity until they complete this training course required. minimum penalties for a coach found in violation of these requirements. So if they don't take it or do the test that they have to take prior to coaching, in the subsection C and D of the bill, the penalties will actually take effect 2 years following the effective date of when that section starts. So for a first violation, if they don't take the test, suspension from coaching, any athletic activity for the remainder of the season. Second violation, they get suspended from coaching for the remainder of the season and for next season. And after the third violation, they're suspended from coaching any athletic activity in the high school. The educational materials that are available and the student athlete and parent requirements from the Department of Health and Education they've developed and posted guidelines and other materials which will help inform and educate the students, whether they're participating in or desiring to participate in any athletic activity. This information will help the parents and their coaches understand the nature and risk of head injury, including the risks associated with continuing to play or practice after a head injury. And in developing the guidelines and materials, the departments will utilize existing materials developed by the CDC. The student participating in or wanting to participate in an athletic activity and their parents shall every year prior to playing, they need to sign and return to the school an acknowledgement of receipt and review of the concussion and traumatic brain injury information sheet developed under this subsection, also in the Senate Bill 200. And this is actually the pre-participation physical exam. This is our section 3. This is the newest. It's very small, you can't really see it, but this is the section 3 part of the form that they will have to read and then sign that they acknowledge and understand concussion and head injury. So in the news, that's what most people are talking about is the stories that you hear of people with concussions, the older players who are coming forward from the NFL, all of these things people are stepping forward. Now we're hearing about it left and right with the new concussion guidelines with the NFL and everything that's been in the forefront of the news. There was an article back in 2005. I thought this was one of the best articles I'd ever read. It's called "This is Your Brain on Multiple Concussions." It was from Men's Health magazine. And it started out, you've probably never heard of post-concussion syndrome, but neither had Harry Carson or Pat LaFontaine or dozens of other former pro athletes. Then the symptoms started. And the rest of the article just continued to talk about how concussion isn't something that you're going to see on a CAT scan unless they have like a brain bleed or something. It's a metabolic injury that, like I described earlier, can just be present with just one symptom. And then the rest of the article talked about what these former athletes have had to deal with in their lives to date, as far as what they've been suffering with post-concussion syndrome. And then we've all seen the news with the ex-players suing the NFL in Louisiana. This was, I don't know, I think since I made this presentation, I think more players are coming forward. But all of these players living in Louisiana are suing the NFL. They're accusing the league of failing to protect the players from the risks associated with concussions. And then there was another study out that was in the U.S. News World Report saying that concussions are affecting teens more than kids and adults, and that teenagers who suffer a concussion are more sensitive than adults or children to its after effects. And this was from a study done up in Canada. And then also in the news, this was not in a good way. These are all former athletes who, I'm sad to say, they died pretty tragic deaths, mostly from suicide, I think. All at this, some were at young ages. Chris Henry was he played for the Bengals, I believe, and he was the one who, I don't know if you remember, he jumped on the back of a pickup truck after his girlfriend or something and then fell off it, and They said that it was a domestic dispute and an accident, but once they did the autopsy, they found something in Chris Henry that I'm going to talk about in a second that led the doctors and the physicians to believe that the reason he acted in this manner was because of a brain condition that he now had from too many concussions in the past, which is called chronic traumatic encephalopathy, or CTE. It's a progressive degenerative disease of the brain. It's found in athletes and others who have a history of repetitive brain trauma, including symptomatic concussions as well as asymptomatic subconcussive hits to the head. It's been known to affect boxers since the 20s, but recent reports have been published of the neuropathology confirmed in CTE that is being seen in retired professional football players, other athletes who have a history of repetitive brain injuries. What happens is the trauma triggers progressive degeneration of brain tissue, including buildup of an abnormal protein called tau. These changes in the brain can begin months, years, or even decades after the last brain injury at the end of their active athletic involvement. And then the brain degeneration is associated with memory loss, confusion, impaired judgment, impulse control problems, aggression, depression, and eventually progressive dementia. And like the athletes listed on the slide before, they were linked to deaths from drug overdoses and suicides in a growing number of professional athletes. And the scary thing is that research has only shown CTE in postmortem brain studies, meaning you can't take a boxer who's in their 70s now and going through dementia and say you have CTE. It's only seen once you do an autopsy, and it's in, after they see it, after you've passed away. So the hope for the future is that they're continuing research by the concussion specialists throughout the world and developing protocols beginning in the NFL and gradually working their way into the NBA. And these laws are being developed to protect our student athletes, and they're being passed in 30+ states. So just like our Senate bill in Pennsylvania, in 30 other states, they're also being passed. And this is to increase awareness so parents, coaches, and athletes can be aware of what's going on and hope to prevent excessive head injury. So the Q&A session, if you have any questions, we can talk now. This was, like I said, for a high school presentation in case there was 800 parents who threw their hands up. So these were just my resources. We have a standard operating procedures manual that we keep all our guidelines in, and we used all the latest research to put this together. These are some links to check out if you want to learn more. The CDC, that's going to be where they're going to give you that material that you need to read, and the educational materials that you have to take the test for. And then the Brain Injury Association, that's a good one to check out. And then our athletic trainers' websites. And thank you for your time.
Thank you, Christina. Like Chris said, my name is Tibor Bodi. I'm the athletic trainer at Liberty High School. Christina just basically told you about what to look for in a concussion, what a concussion is. I'm going to tell you about what to do when your athlete has a concussion and how they gradually return to play. All right. Whoa. There we go. So what is a concussion? Christina just went over that, so we can skip that. Once diagnosed, now what do we do? Once a concussion has been diagnosed, the athletic trainer, since you guys don't have an athletic trainer, it would pretty much, you'd refer them to a physician, and the physician would then work with you on the return to play guidelines. I'm actually going to go through the guidelines day by day. By the way, if I'm talking too fast, just let me know. I'll slow down. I tend to get kind of excited. So, an athlete will begin these return to play guidelines once they've been asymptomatic for 24 hours. Again, and also one thing that a lot of people forget is while performing daily activities. So they might not have a headache, no symptoms, but the minute they sit down and try and read a book, their headache comes back, that disqualifies them. They're not asymptomatic. So they have to be completely symptom-free for a full 24 hours. They are also to successfully complete an impact test with no significant changes since the baseline prior to returning to competition. This is basically a brief overview of our return to play guidelines. The handout that you guys received, the second page of that has a little chart. That is basically what we're going to be going over right now. Day 0 is no activity. This is the rest and recovery day. This is the first, once the athlete has been asymptomatic for 24 hours, it's day 0. Day 1 is now when we begin to actually return them to play gradually. They want light aerobic exercise, like push-ups, squats, swimming, cycling, those kinds of activities. The goal is to increase the heart rate with no return of symptoms. The biggest thing with this is you want to increase the heart rate without having any rapid head movement. You don't want to do too much too fast. So by having them running is a little too much. Riding the bike, something where their head is going to be mostly stationary. Push-ups is probably the most extreme that I would get on this day, just because it's a constant movement with the head and the body. After they've gone through that day with no symptoms, we continue them to day 2. Day 2 is more sport specific. This is your running, your sprinting, your cutting. In this day, you can actually get the head movement, the side-to-side movement, not so much jarring movement, but a little bit more intense than day 1. And again, like I said, this is increased heart rate with added movement. So those are the first 3 days, and then continue. These are the last 3 days of the return to play guidelines. Day 3, non-contact drills. You guys are football coaches, this would be throwing, kicking, having your receiver catch the ball, any kind of like resistance training, weightlifting, stuff like that. Basically, the goal of this is exercise with coordination and a cognitive load. Hand-eye coordination, running, then catching the ball. Your brain gets impulses, and that is actually considered a cognitive load. They go through day 3 with no symptoms. Day 4, full contact practice. This is a full contact monitored practice. You need to go through the normal practice routine with no change, with no increase in symptoms, and this is where the coach will assess the athlete's performance. If Johnny's acting sluggish in practice, not his normal self, he's not ready. That means he's not ready to return. He's not ready for day 5. Day 5 is the full contact, no restrictions, but they will be monitored during play. Even though they are fully cleared to play, I myself always like to monitor the post-concussion athletes just to be on the safe side. If they're acting sluggish, if they're not acting themselves, forgetting things, they need to be pulled. Especially in youth athletes, concussions are no joke. The brain does a lot of developing. If you injure a developing brain, it can cause long-term effects down the road. And a little note, Christina talked about the impact testing. It'll be used prior to returning to play at the discretion of the athletic trainer, which the discretion is we always use it now. Why we do this? Basically, gradual progression. Each day becomes more difficult. The idea is to increase blood flow to the brain. A concussion essentially causes swelling in the brain. Because of the skull, that swelling has nowhere to go. So if you increase blood flow to the brain, that increases the amount of basically stuff in the brain. The swelling has nowhere to go, so it compresses the brain. If there's swelling in the brain still, that'll cause a return of symptoms, headache, dizziness, nausea, etc. All right. If there is no concussion, the increased blood flow will act normally. There will be no increase of symptoms, no headaches, no dizziness, no nausea. Again, stressing the brain and return of symptoms. If any symptoms return at any point in time, they return back to day 0, and they have to be asymptomatic for a full 24 hours before you can begin this protocol again. All right? Any questions? I know that was short, but really it's more along the lines of you need to be seen by a physician, and the physician will help you, will guide you through these return to play protocols. And the most important thing is that if they get a return to symptoms, you knock them back down to day 0. All right? With youth today, you do not want a concussion today to affect them tomorrow. Second impact syndrome is a very, very big deal. We want to avoid that as much as possible. Are all of you familiar with second impact syndrome? All right, okay, that's right. Second impact syndrome. Basically, if you have a concussion that goes unresolved and you receive an impact that would basically cause a second concussion, the effects of that become exponentially worse. You have an extreme sensitivity to light. You can't walk outside. You can't balance. It basically is very detrimental to your health. There have been athletes that have even died from second impact syndrome. I don't recall where I got the report, but there was a report of a high school football player, I believe in, I want to say Connecticut or Massachusetts. He played special teams in the varsity game on Saturday, received the hit, concussion went undiagnosed, told his mother he had headaches, he was dizzy, he threw up on Sunday. played in a JV game on Monday, received another hit, and you know, he woke up the next day. He had a headache, nothing worse than it was before. By the end of the week, he was dead. Those are the situations that we would like to avoid, obviously. So that's why concussions, especially in youth, you need to be overly conservative with your diagnosis. If a kid comes to you, gets walloped, has a headache, in my opinion, I would hold him out. I don't care what the game is, who you're playing, what the stakes are, hold him out. Today's game is not worth tomorrow's future. All right, does anybody have any questions? No? All right.
I know you guys are probably sick of concussions, but this is a little bit different, but equally important issue here, sudden cardiac arrest. It doesn't just happen to old people, it can happen to kids, it can happen to young adults, anybody. So Senate bill from Pennsylvania Senate, number 1610. Are all you guys from Pennsylvania, or anybody coach in Jersey, or? Okay, so that makes it easier. This is a new bill that just came out. It's going into effect very soon. And what it's doing is requiring the removal of any athletes with signs and symptoms of sudden cardiac arrest. And it's trying to promote education and awareness of it to prevent any issues in youth sports. And one of the other keys is it requires coaches to attend a training course every year for awareness of it. Common causes of sudden cardiac arrest is ventricular fibrillation. Basically, that just means the heart has a very irregular beat and it cannot distribute blood through the system. Hypertrophic cardiomyopathy, you might have heard the health experts refer to it as HOCM. That's actually the most common cause of sudden cardiac death in people under age 35. And the photo, or the picture in the bottom, shows normal heart and a heart with HOCM on the right. And basically, it's just a thickening of the walls of the heart, and it very often goes undetected until it actually causes problems, and unfortunately a lot of young people die from it. Congenital abnormalities of the coronary arteries, obviously that's a problem because coronary arteries are what supply the heart with blood flow so it can do its job. Other diseases, myocarditis is swelling in the heart, dilated cardiomyopathy, long QT syndrome, which is it's irregular electrical activity causing problems in the heart, and Marfan syndrome. A good way to look to try and pick out Marfan syndrome is it's very often characterized by having very long arms and legs. Signs and symptoms, which I think is the most important part for coaches to be aware of, because you guys are the ones that'll see this. Fainting, seizures, convulsions during physical activity, that can be a sign of cardiac problems. Any sort of sudden increase in heart rate caused by being startled, excitement, things like that, causing fainting or a seizure can be a sign. Dizziness or lightheadedness, especially during exercise. Palpitations, basically somebody says that their heart, it doesn't feel like it's beating right, like it feels like it's skipping a beat, things like that. Fatigue and being unable to keep up with friends. I know that's sometimes you see that just because kids are out of shape, or sometimes they have asthma, but it's also important to consider the possibility that they could have a cardiac issue if you're seeing that. So what we're doing for screening is, in the schools, all school athletes are required to have a physical every year done by a doctor, nurse practitioner, or physician's assistant. And prior to the physical exam, students and their parents are required to do a thorough health history. So, these questions are going to be about problems that the kids have during exercise, and questions about family history. A lot of these problems run in the family. So if a family member has a history of sudden death or having any sort of cardio cardiovascular issues, then there's a chance that the student athlete can have it as well. So what happens when there's a red flag on a physical exam or on a health history questionnaire? If a student is removed because these signs and symptoms have been displayed, they must be seen by a doctor, and they cannot return until having been seen. Or if, like I said, if something comes up during a physical exam, then a doctor may ask that the student see a cardiac doctor or cardiologist. In the picture here is Dr. Scolobianco. He's one of our cardiologists here at Coordinated Health. So the new health bill, the website. I checked the website. They need to update that a little bit better. We're currently in the process of. We've formed a committee to try and improve awareness and get some like official training approval so that we can help coaches do what they need to do, just so that everybody's in line. The signature forms, it's kind of like what Christina showed with the concussion awareness. Students and their parents are going to be required to sign a form saying that they've read about sudden cardiac arrest and the signs and symptoms, recognition, and all that. And that's going to have to be signed and returned before an athlete can participate. Informational meetings. They're encouraging school entities to have meetings at the beginning of each season for coaches, students, and parents. The thing that is important to coaches is the ramifications. They're very similar to the concussion bill in that if a coach doesn't remove a student that's showing signs or has a cardiac condition, then they can be suspended for the rest of the remaining year. The second offense is the rest of this season and the following season, and then the third offense is permanent suspension from coaching. So what it comes down to is if you see a kid with symptoms that are listed, you need to remove them. It's just like having a shoulder injury. If they're showing these signs and symptoms, then they're not allowed to play until they're cleared. So just quick review. In order to return, they need to be cleared by a physician, nurse practitioner, cardiologist. If they have a previous history, then they're going to need further evaluation. If a kid gets pulled, they need to be seen by a doctor, a nurse practitioner, or cardiologist. As soon as they're ready to return to play, then that's when they need to get cleared. And the training courses, the coaches are going to be required to attend training courses. And then it's going to be just like the kids. If you don't do your homework, you don't get your physical done, you don't get your health history done, you can't participate. Same thing for coaches. They can't coach until completing the training. Any other questions?
Okay. Thanks, Pat.
All right, thank you guys.
What was just said is going to kind of lead into my presentation. First aid for coaches, but what I'm really talking about, I mean, that's a huge topic, dealing with all kind of different problems. But really, we're kind of give you a little quick overview here, kind of like what you need to know, what your involvement's going to be, what your role is, and that's kind of where you're at right now. We'll probably skip the trainer role. But the keys to any successful program, doesn't matter if it's the football program itself or dealing with medical issues, is communication between coaches, between your administration, between your parents, that kind of stuff. You got to kind of get that all worked out ahead of time, and then have a good working relationship with each other so that when something happens, everybody's on the same page, kind of thing. So The National Federation of State High School Associations recommends that all coaches, regardless of what level, be certified in CPR and AED and first aid certification. And I don't know, does Moore Township require that, or anybody here have that certification? Yeah, okay. We here at Coordinate, I believe, do offer those, possibly. We take it here ourselves. So if you guys are interested in it, maybe that's something that if you want to have coaches certified in that, we can work something out. Also, the NFSHS offers it through different programs, and you can go to that phone number, that website, look on there and kind of get some more information that way too. Anyway, the big deal I think that and the frustration that you guys may have is that you don't have what's called an emergency action plan. Okay, you don't have like a stepwise progression. If something happens, you know, what do we do, kind of thing. Your emergency action plan is going to deal with all kind of things. It could be spinal injuries and heat injuries, fractures, you know, concussions we talked about today. You know, head and eye injuries, even things like diabetes and allergic reactions, and how do you handle that? Even, you know, what you're going to see most of is the orthopedic injuries, you know, knees and ankles and those kind of things. And it's really, you know, there's a nice little picture. It's really, oh, I'm just going to show you this. This is just, I got two charts here, two graphs, and we try to keep the graphs to a minimum. But just to reinforce that, you know, and you guys see it on the field, you know, there's always somebody gets hurt at some point during the season. This happens to be fatalities in football, and you can see before the spearing rule came out, you know, there's quite a lot, you know, so that helped us, you know, deal with those. 1990 was the only year that no one actually died playing football. Statistically, you know, high school kids are more likely to die in a football, I mean in a car wreck, than they are on the football field, but these injuries do occur, and you need to be prepared to deal with them, and that's the key point. And here's just another chart of different types of injuries that resulted in them, you know, maybe becoming paralyzed, you know, fatalities, those kind of things. So injuries do occur. The take-home point being, got to be ready, got to be prepared to handle that kind of stuff. So what is your primary responsibility on the field medically? Number one would be injury prevention, okay? So you guys are the front runners. You guys set the tone for practices, what can be done, and you know, you kind of want to take a stepwise approach, know where these kids are at in the beginning and know where you can progress them to safely. There's different guidelines out, PIAA, National Federation High School Sports, and certain youth sports associations also have different guidelines. And you can go to PIAA.org, the NFHS website, those kind of things, and they have some different, you know, guidelines there you can look at. Your second responsibility is you guys, especially in the youth, are the only one there to take care of the injury. You know, unless a parent's there at a game or something that happens to be a doctor or something like that. Do you guys have like EMS at games? You do. Okay, that's good. So you guys on practice field, which actually more injuries usually occur in a practice setting, depending on how much contact you're doing, than they do in a game. So in that respect, you got to be prepared again, and you're gonna prepare yourself because you're gonna have an emergency action plan to back you up. All right, and what is that? Well, it's a blueprint on how you're going to respond to medical emergency situations. Now for us, every school has one. You know, high school, middle school that we cover, and every school in Pennsylvania really should have one. And it's going to be unique for each school, each location. You may be at one field, and you know, that field may have a telephone available, it may not. So you need to think about, well, how am I calling 911? Am I going to use a cell phone? What am I going to do, you know? And those are kind of things that you want to spell out ahead of time so that you kind of know what's going on. It also delineates roles for people. So depending on how many coaches you have on the sideline, how are you going to handle a spinal cord injury? You know, obviously, you know, and that maybe that goes south and it turns into a cardiac emergency, and you may be pretty far out where an ambulance can't get to you, or maybe all the ambulances are already on call and it's going to take some time. Are you ready? Are you able to perform CPR? Who's there to be able to do that? If you have an AED, who's getting that? Who's making the call to 911? Those kind of things all get spelled out. And at our level, at the high school, we sit down with the athletic director, we sit down, with the head coach and a lot of his paid coaches. But some of those assistant coaches that are not paid, a lot of this information doesn't get filtered down to that level. So it's important actually that those assistant coaches, those volunteer coaches are in on those meetings and that they're up to speed on everything. But you also have to prepare make sure you've got your med kit, know what you want in it, what your township or whatever can afford to keep in those kits, and make sure they travel with you if you go to an away game, or make an arrangement with the host that they're going to provide maybe ice and water and those kind of things, and see how that goes. And then if you do want to practice certain situations ahead of time, just like you would on the football field. You're gonna run through your offensive drills. Well, it's the same thing here. You wanna practice when things are okay. Maybe have a kid be the body on the ground, and you guys can run through a scenario of how you're gonna handle this type of injury. Could be a broken arm, could be whatever. But practice it. And that way, when it really does occur, you're not going to be nervous and forget what to do. You're going to be ready to go. So, what does the plan contain? Again, your personnel, who's doing what, communication methods, how you're going to communicate with EMS, your parents, your athletic department, or your township. Who's going to make those calls? That kind of stuff. What equipment you're going to have? You're going to have medical kits. Do you have AEDs or not? Do you have oxygen or not? Do you have EpiPens if somebody has an allergic reaction? Those kind of things. And also any paperwork. Everything these days seems to turn into a lawsuit at some point. So if you can document what you did and how you appropriately took care of something ahead of time, it kind of saves you. Now we keep athletes' medical histories on hand, and that helps us too. If we do call 911, we can say, this kid has this problem, he's taking these medications and this and that, and they're ready to go. They can adjust what medications they're going to give him, when they get there. Contact information is important. You guys all have, parent, cell numbers and all that kind of stuff. And then, like I said, current medications. But the big thing that we have now in our PIAA forms is like signed consent for medical treatment. If you're calling 911, I don't think it's really that necessary per se. I think it's kind of understood. But if you have maybe an athletic trainer covering a big tournament or something like that, it might be a good idea to have signed medical consent, especially if you can't reach a parent on the phone and you want to treat a kid. That saves you a lot of headache. And then lastly, it's going to have all your emergency care protocols, and I'll show you at the end here a little website that has a lot of information, so you guys can look at that on your own and get all that. But the take-home points being, know your team, who's going to take care of what, practice, so that if you do have an allergic reaction, if you do have this and that, you guys can handle that situation and be that proactive to prevent further injury, to prevent things from going too south before more competent medical help arrives. And then I have other things, but that's about it. But any questions at all? Well, thanks for coming, and like I said, we're always available to talk to you if you have any other further questions or whatnot.